Good morning, good afternoon, or good evening, and welcome back to Bariatrics and Beyond, the podcast where we talk about life before, during, and beyond bariatric surgery. On today's episode, we have a very special guest, one of our plastic surgeons, to talk about life beyond bariatric surgery. We have, all the way from Tijuana, Mexico, Dr. Eduardo Ochoa. Hi.
Thank you so much. Thank you for inviting me.
Thanks for coming. We love
Very
you, Dr.
exciting.
Ochoa. So can you introduce yourself, give us a little bit of a, get to know Dr. Ochoa?
Okay, awesome. My name is Eduardo Ochoa. I'm almost 39 years old, still 38 until December. I've been a plastic surgeon for about almost 7 years now. Okay. And I was born in a small town called Tampico, Tamaulipas, that is on the other side of Mexico, far away from Tijuana.
Oh,
But my family moved here when I was like 7, 8 years old. So I've been making Tijuana my home since then.
well, that's awesome. So can you talk to us a little bit about your schooling, about, how did you become a doctor and what made you want to do that?
Wow, that's a difficult question. I think I decided to become a doctor since I was like 5 or 6 years old. My grandma always took care of me, and she's always like saying, "You're gonna be a doctor when you grow up." And
Oh.
uh, I went with her to her doctor appointments. So I think something must have stuck with me. Also,
Oh.
my father, he went to med school for 3 semesters, but he just couldn't handle the blood and all the
Oh.
med things he used to see, so he quit. So that pretty much felt like a challenge for me. So
Uh-huh.
okay, maybe I'm gonna go in there and finish what he couldn't and make him proud.
Oh, that's awesome. And I bet you did just that, made him very proud. So if you weren't a plastic surgeon, what would you be?
Oh man, I have Mm. I have two very good options in my opinion. One would be a singer from like a rock band. I would love to do that.
Really?
But I have no talent at all for
Oh,
that.
that was my next question.
I can't sing, and
Oh.
you will never sing me sing in your life. So very bad at it. And
Oh.
uh, my other choice, and probably the top choice, would have been a soccer player. A professional soccer player have been incredible.
So what, can you sing better than you play soccer, or do you play soccer better than you sing?
I play better than I sing, I
Okay.
think,
Okay, okay.
and that is not much to say.
You're like, "It's not hard." That's so funny. Alright, so Dr. Choi, you are a very popular plastic surgeon here at EOC. Everybody loves you, and I've got a few questions that, the Facebook group wanna know, but first, I'm just gonna ask you a few questions if you don't mind. Um, can you take us through what a day in the life of Dr. Ochoa looks like?
Oh man, the day in my life is
Yeah.
super boring.
Oh, come on, I
Mhm.
doubt it.
Nothing actually remarkable, but probably the surgery is the most exciting part. You know, wake up, make some coffee, prepare to work. Uh, prepare my children to put on uniforms for school, and rush to the hospital day by day. Surgery is always a little different. No patient is the same,
Mhm.
but uh, you know, we have 5, 6 hours of surgery. Then out of surgery, go to my house, have lunch with my family, and then consultation.
Okay.
After consultation, I like to go to the gym. Probably you've heard this before, but Dr. Nick is my gym bro, so
I
we
love
go
that.
we go at least 3 times a week. Okay, so Monday, Wednesday, Friday, and we give our best. And Tuesdays and Thursdays, I have tennis lessons.
I'm exhausted just listening to that. You're like, "Look, nothing exciting. I just, change people's lives all day long. It's only about 5-6 hours. Then I go to the gym in between, like getting my kids ready. Then,
Sure.
yeah, when I have a little bit more free time, I just, go play tennis. Like that is that's just remarkable to me. Like, where do you get your energy? I aspire to be half as, productive as that. So that's
I
fantastic.
like everything that is physical, you know.
Yeah.
I can't stay like without moving and
Mm.
active. And there's a lot of stress in our work, so that really helps. Gym and tennis lessons help a lot to relieve some stress.
I bet. And you'd have to be physically fit, like, to perform surgery for 5 hours straight, and also because you guys are, like, flipping things and lifting things, like, you kinda have to be a little bit strong, huh?
Yes, definitely.
Yeah.
What gets you more out of you is liposuction. I
Mm.
get very tired from liposuction, and there's almost no surgery without liposuction. It helps a lot to achieve the goals. So you have to have strong arms and
Oh,
a good shoulder.
yeah, because 'cause you're doing that, like, a million
I help
times.
it like a million times. I have no idea how many times, thousands of times each surgery.
Wow, so, yeah, you never skip arm day. It's every day is shoulder day.
Yeah.
That's crazy. So you were talking about the consultation. So with EOC, all of our consultations are done virtually. So, patients send in their health application and then they attach the pictures. So how do you, when you see these pictures, like how do you determine what does, a patient need? And when you do meet them in person for the first time, does the surgery plan change too often?
Okay. Very good question. Uh, I think we all have now a lot of experience by evaluating pictures and determine a patient's needs just with the pictures.
Mm,
Of course, sometimes angles can change, distance of the picture, so some things can play against you when you're determining and planning a surgery, but it is very uncommon for it to change, and if the plan changes is because the patient was in between one procedure or the other,
mhm.
like, should I do extended breast lift or just breast lift, or does she really needs torsoplasty? But those little changes can be made in the office because we see the patient one day before,
Mhm.
and when we're doing all the markings, we can determine more accurately if we really need some procedure or what's the best option to get the best result in that patient.
Perfect. And that was leading into my next question is the pre-op appointment. So can you walk us through a little bit about the pre-op appointment?
Pre-op appointment is as important as the surgery. Okay,
Wow.
it's incredibly important. Uh, I want to explain a little bit better, especially Mondays. Mondays are difficult because we do not open the office on Sundays. It's
Mhm.
our only day off
Mhm.
for, I think, all EOC plastic surgeons. So we do pre-op at Monday. Uh, and I want to tell our Monday patients that things go in a different order, but the results are the same.
Mhm.
Okay. So for Mondays, patient gets to the hospital first. Okay. Fills up the paperwork. Okay, and gets the IV placed on. So sometimes they don't want to have the IV on or sign anything until they see me and they talk to me and
Mhm.
go through all their goals and what will be done. I want to tell everyone who's booked on a Monday, let them do all these things.
Yeah.
Okay, it's just to keep the ball rolling,
Yep.
and we don't lose that way. We don't lose more time, and if anything changes, even if you sign up for it, if your plan changes, it's not because you sign. I'm gonna do what the paper says, right?
Yep.
If you're not sure you want the torsoplasty or if you really need it, just sign the paper. And when I talk to you, you will tell me if you don't want it, and we can just not uh,
Mhm.
torsoplasty or I'll tell you if you need it, and we can decide together. So it's not like you're signing and you're now forced
Obligated,
to start.
yeah.
Yeah,
Mhm.
that it won't. It doesn't work that way. We won't do anything that you don't want to. Okay, that's the first thing. And the IV, um, I think it's not gonna harm you to have the IV on. In case that your surgery is canceled at the last minute, uh, well, the only thing you receive is a
A
little
little,
extra pitch. No
yeah.
big deal. Actually, the big deal would be the cancellation, but that is super uncommon
Mhm.
because in order for you to get here is because you already passed so many filters.
Yep.
I'm not gonna say it has never happened, but it is super uncommon.
Super uncommon. What are some of the most commonly asked questions during the pre-op appointment?
During pre-op appointment, one area of great concern is the pubic area.
Mhm.
It is always lifted if we notice that there's a thick fat deposit there. We will also decrease that and remove that fat. Also, that they asked if they're getting muscle repair. I think I haven't done one single tummy tuck without muscle repair. It's
Mhm.
always part of it. Okay,
Yep.
you're already there. If it can help in any way, you have to do it. Okay,
Mhm.
and I didn't explain pre-op appointments here in the office.
Oh,
Okay,
yep. Mhm.
uh, your driver will first get you to the hospital, and they will take a blood sample to do your labs, so we can run your labs. Then they will bring it to the office. That's very close. It's only 2 blocks away, and there you will fill your paperwork. Okay, you come in. We talk about your goals and your expectations with the surgery, and then the most feared time, patient needs to undress completely.
Mhm.
The only thing that they can leave on uh, are socks. That's it. Okay. I'm never alone with the patient. We have always one assistant or a couple of them to
Mhm.
help with the pictures and markings.
Mhm.
Um, then I do a full evaluation and I start doing all the plan, all the markings, and I beg my patients not to erase those lines because you can take 30, 40 minutes drawing those lines,
Yes.
and they're very important.
Yeah, I've been lucky enough to be in one of your pre-op appointments where you
Yeah,
were
yes,
marking up
me, right?
Haley, your
Yeah.
coordinator. And you guys, it is like so cool to watch. Like you are a master, and the way you just measure everything, which I got a question for you, but I'm gonna go into that later because everybody wants to know this question, but we're gonna circle back and go into that later. But the way you are in your pre-op appointment is just like zoned in. Um, yeah, and then you also talk about implant sizes too during the pre-op because I think that's a big question for everybody because I think they see like, oh, I want my boobs to look like hers, or they ask people what size are yours, but it all depends on like what fits your frame. So you measure all that up too, don't you?
Yes, exactly.
Mm-hmm.
We have to make some measurements to see what implant will fit you well, and it's not like there's only one correct option for you. So, according to the breast size and the chest, you know you're able to use maybe 2 or 3 different implant sizes, and then according to the patient's goals, if she wants to be smaller or larger, she can decide what implant to get. And here in the office, we have several sizes so they can have an idea
Yeah,
of what they want to get.
that's a big
So
one.
this is a 575.
That's
So it's
bigger
very
than my
large.
head, I reckon.
Yeah. So uh, that gives you a very good idea. Also
Yeah.
lets you to feel it,
Mm-hmm.
how natural it feels and how resistant the material is. Like you can squeeze it, you can pull it.
Yep. Wow. What
Okay.
can you explain what the implants are, the name of them? Are they textured? Are they, all the
We
implant lingo?
we only use silicone implants.
Mhm.
Okay. So no saline. I don't like them. I have removed several,
Mhm.
and in my opinion, they never look good. And these all are round implants, silicone. The material is called high cohesive silicone, okay? High cohesive gel.
Mm-hmm.
So that means that if you cut the implant in half, you can split it. It won't spill. It's not liquid like the old implants.
Mm-hmm.
So that's why they call them gummy bear implants.
Uh-huh. So if you were to cut a gummy bear in half, it's kind of the same texture as an
Yes, it's
implant.
not liquid. It's more like a solid or like a gel.
Well, that makes sense now. That's why. I was like, where does the gummy bear thing come from? I'm like, is it like shaped like a gummy bear? I don't get it.
We use two brands. Most of the implants we use are Motiva,
Mm-hmm.
okay, but we also use Silimed. Okay, both are really really good. It's not like one is more expensive than the other. Because I've heard some comments about that. They're pretty much the same cost, and they're both really good implants. Motiva is a newer brand. Okay,
Mm-hmm.
so just got the FDA approval. Okay, and Silimed has been more time around, so
Okay.
there's no experience with Silimed, but whatever you have, it's great. And why we work with both is because sometimes one brand can be out of stock, but you
Mm-hmm.
have the other option, red.
Perfect. Perfect. I love that. Okay,
You don't
so
want to run out of implants.
no, well, we can't. We all
That's a
must.
tragedy.
It would be a tragedy. We all need the boobs. So, okay, people they're at their pre-op appointment. They're all marked up. They go back to the hotel for the afternoon, the evening, the night. Next day's surgery. So, can you explain what to expect on surgery day?
Okay, surgery day, everything happens really quick, you know.
Mm-hmm.
Your driver will tell you what time they will pick you up at the lobby. They bring you to a hospital. You're gonna have some doctors from the hospital ask you the same questions that we have asked again. Okay, but it's part of the process.
Yeah.
We have many checkpoints, and I think that's what makes us safe, you know.
Yes.
So, uh, paperwork, IB, they will put your robe, your compression socks. Then you will meet the anesthesiologist. You will talk to him about all your concerns, your questions about pain management. You can talk to him about previous experiences with anesthesia and your previous surgeries, so he can know you better
Mm-hmm.
and know what to expect from you and how you behave during anesthesia and after anesthesia, so you can customize his anesthesia according to your needs. Okay, and that way we prevent more nausea, vomit, okay, pain, and everything works better that way. And you will also meet Dr. Gastelum, who will do your physical evaluation, and he has the final say if the surgery can be done. Okay, so he checks your EKG. Sometimes if he looks something is not quite right in your EKG or might not be normal, he can also do an ultrasound right there in the moment to see how your heart is moving and behaving. And if it's all good, we can proceed with surgery.
I love that. So there are a lot of checkpoints that you go through. So safety first, you guys.
Yes.
Yep, I love that. Okay, so now it's surgery time. They get rolled into the OR and then they get their dream body. After surgery, they go back to the room. How long are they at the hospital for?
Okay. Right when surgery is over, I wait until the patient is out of the OR,
Hmm.
then into the recovery area. I change back again to my clothes, and the first thing I do is go with the companion, with a family member, a spouse, or a friend, to tell them how everything went, what we find in the surgery, what we did, and the patient stays in the recovery area for about 1 to 2 hours.
Hmm.
Okay, waiting for to process the medication used during anesthesia. And once the patient is more awake, more conscious, they are transferred to the room.
Nice. And they stay
They,
there overnight,
they
do
will
they?
they will stay for the night.
Hmm.
And uh, the next morning, I'll go to check on the patient. Okay, we remove bandages. We see how the incisions look, how the skin looks, how the patient's feeling, vital signs. We run another blood test to make sure we don't need transfusion. That gives us a very good idea of how much blood was lost and if we need any blood. Not very common. We use transfusions probably once every 3 months.
Mhm.
S- Uh, Not very common, but it happens.
Is that because of the lipo?
Uh, can be many things.
Mhm.
Liposuction is what can cause more bleeding than other things, but not only that, also when you remove 10 pounds of skin,
Mm.
there's a lot of blood trapped in that skin that is removed. So you're losing that instantly, you know?
Yeah.
Uh, Sometimes we find big blood vessels, big veins, or small veins that are continuously bleeding and a
Mhm.
little harder to control. So there are very different things that can happen to cause blood loss.
That that makes sense.
That's why we are very emphatic when we ask our patients to stop vitamins. It's super important to stop vitamins because they make your blood thinner and
Ah.
they cause more bleeding. And some patients think we are only talking about pills or gummy vitamins, you know?
Mhm.
But it's not only that. If you drink a Red Bull, you'll find that it has B vitamins that can cause bleeding. Okay. If you take any protein supplement, for example, many of them are have vitamins on it added. So you
Yeah.
have to be very aware of supplements and drinks and food that you're taking because some of them will have vitamins and will increase your blood loss during surgery. So not only stopping uh, the pills,
Mm.
your multivitamins.
Yeah, just several different sources. I would have never thought about that. So thank you for bringing that up. But the coordinators, give all this information to the patient prior to surgery, and their hemoglobin has to be what?
Uh, the level that we ask for hemoglobin to in order to do a combination of procedures is 13.
Okay,
Okay.
so that.
Some patients when they get here, they have like 12.9, 12.7. I mean, not much difference. We can
Mhm.
still uh, plan to do everything. Okay. Just if they start bleeding too much, then we might need to stop one procedure maybe, or
Mhm.
not do as much liposuction as was planned at first. But you have to adapt. Okay, it's
Yeah.
not like you get here and you with 12.7 you're gonna have your surgery canceled.
Right.
It doesn't work that way. But if you arrive here with 10, you're gonna have your surgery
Surgery
canceled
cancer.
for
Yeah,
sure.
right. So try and get it as high as possible, you guys. And then if you want more lipo, just get that hemoglobin up higher. So
Yeah, exactly.
right. Okay, so after surgery, when does their faja go on?
Okay, good question. The faja will be put on the day after surgery.
Okay.
So after you walk, the nurses will help you shower, dry, and then they will put on your faja. Okay, they will help you. You'll have assistance. It's very hard to put on a faja, especially the for the patient
Yeah.
the day after surgery. It's impossible.
Mm,
Okay,
I
because it's very tight.
agree.
So the nurses will help you get you ready, including placing your faja, so you can leave for the hotel.
Perfect. And then yeah, they go back to the hotel and they've got nurses who care for them there. And then there's another post-op appointment with you. So what's that, day 5, correct?
Yes, it is usually done at day 5,
Mm-hmm.
but I'm always receiving reports about every patient daily. The massage therapist and also Dr. Medina, who is my assistant, and he works with me in the surgeries. When we finish surgery, he goes and visits all our patients at the hotel to check on them, and he reports me how they're feeling, how they're looking, how they're healing, and if we need to do anything differently, we start early treatment and improve things as soon as we notice something's not perfect.
Mm-hmm.
and we don't have to wait until I see the patient in the office. Okay, so I'm here in consultation, and he's at the hotel checking that everything's going well.
Right. So there's always a set of eyes on them.
There's always I know if a patient is behaving well, or if a patient is just uh walking all the hotel, wandering
Mhm.
around, on a tour. I know everything, you know.
Guys, they got eyes in the sky. They see it
Yes.
all.
we,
Don't you plastic surgery patients, don't be thinking you can go relax down by the pool. Mm-mm, these doctors will find out and you will get in trouble.
we know, we know a
They
lot
know. They
more
got
than more than they know. Yeah.
they're
So
watching you.
once they get here, I check that everything's going well. I give additional instructions specifically for that patient and their healing, so we can have the best recovery. Okay.
Mhm.
Also, when they get to the office, they receive their stats in a piece of paper and a reminder with the most important instructions. If I have to say the most important things about recovery, would be resting, because once the patient gets home, sometimes they feel well and they can feel more confident of start doing more things, but you shouldn't. You should wait 3 weeks uh, to rest as much as possible for the first 3 weeks. Then the other thing for a good recovery, compression. Always wear your faja
Mhm.
after 1 week. So when they get home, um, I ask them to use lipoforms under the faja. Okay? That way we have a little extra compression, more shaping, and less chances of fluid collections and swelling. Okay. Uh, Other thing is eating well. Take 1 or 2 protein shakes a day to increase your protein intake. That's what you need the most for healing. Okay.
Mhm.
You can also restart your blood builders when you get home. So iron, folic acid, and vitamin C help a lot. Okay. And the final most important things would be very careful with your incisions, be very clean with them, treat them with a lot of discipline, always clean hands before touching your incisions. Don't let your hair touch your breast, for example. Don't be around your pets when you're
Mhm.
not covered, not dressed. Okay. Don't let them don't let your pets in the bedroom, and always handle your incisions with extreme care, even
Mhm.
after 2 3 weeks. Okay, because every incision, every wound is an opportunity for bacteria to get there and cause big trouble.
Yeah. Well, speaking of trouble, what happens if a complication does occur once they get home?
Okay, first of all, you have to keep calm. Okay, complications happen, and I haven't seen one single complication that has no way to fix it.
Mhm.
So there's always something that we can do to fix that or to improve that. So the first thing you have to do is take a picture and send it with your coordinator and explaining what happened, since when did you notice it wasn't looking right, or uh, what are you feeling. So always give a little context, and also when you send the picture, don't take it in a short distance. Take it from a medium distance so we can see proportions. We can see
Mm.
the, like, for example, the size of an opening and what area we are dealing with, because it's not the same any
Right.
area. Sometimes we just see like a super close up, zoomed in picture,
And it
and
looks
we don't.
like a huge opening and it's like a
eh,
little pinhole.
Yes, yes,
Right, right. So
exactly.
that makes sense. So you guys always be in touch with your coordinator even once you get home. If you have anything of concern, you go to your coordinator and your coordinator is the point of contact to your surgeon. So they will relay everything you any questions that you have. And then let's talk about the drains. How long do they stay in for?
Okay,
Or
drains.
drain?
The drain should last at least 14 days.
Mhm.
Okay, that's the minimum amount of time that it should be. But sometimes, if you're still getting a lot of fluid, then you should keep it a little longer. Okay. It's not a problem if you leave your drain for 3, 4 weeks. Okay.
Mm,
But if you remove it too early, then uh, we can have problems like a fluid collection. It's not like a dangerous thing, okay,
mhm.
but can affect the result, and we don't want that. So, uh, yeah, I ask all the patients to keep your drain a little longer if you're still getting uh, a good amount of fluid. Okay, for my patients, I ask ha- having less than 40 cc's in 24-hour period, then you can remove your drain.
Good to know. Good to know. Okay, now we got some. I put a call out yesterday on the Facebook page, and I asked people, what do you guys want to know? So, um, I'm going to read out some questions from some of the Facebook support page people. Is that okay?
Yes,
Are
of
you
course.
ready?
So,
Okay. This one is from Andrea Hall. She wants to know, along with the rest of the world, we all want to know this. Um, we want to know, how do you achieve your incredible lines? Because Dr. Ochoa, you have impeccable lines. Your work is so neat and tidy. How do you get them so perfect?
well, first of all, I think we all, the force body
Yeah.
surgeons, do really, really nice lines.
Mm-hmm.
But I think I'm no different from them. I don't do anything different. We all have like this very uh, obsessive personality, you know? So I think it's just part of being a plastic surgeon. You are obsessed with perfection, even if you know that you cannot achieve it like 100%, but you want to get as close as possible to that.
Mm-hmm.
So uh, I remember when I started working with Dr. Lassos, every time he saw a little imperfection, he went for it. You know,
Mm-hmm.
how am I going to improve this? And he always found a
Find
way.
a way.
So I learned from him to be like a little even more obsessed with that
Yeah.
than I already was.
Yeah, you guys are perfectionists. But I don't know if this is a secret, and if it is, we can cut it out. But you use a little handy tool during your pre-op appointment that I noticed. Oh, look, I don't know if it's a secret. If it is, we can cut it out. But
Yeah, we can say it.
okay,
No problem. I use the laser. It's the kind they use like when they are doing construction work at homes. You know, it's a normal laser to to make the all the lines and markings as symmetrical as possible. Okay. It has worked really well. I think it's a very good option. I have recommended to many and many other colleagues and plastic surgeons
yeah,
that I know. Uh, I think it's worth it. You know, it really helps.
yes,
And since then, I think the lines have a little more symmetry,
hmm,
and there sometimes one is the thing that you mark in the pre-op, but during the surgery, you can change that according to what you see and how you feel. And after liposuction, sometimes we remove even more skin
mm,
that was planned. So we make some adjustments. And when I started using the laser, we all noticed in the team, the OR, that these adjustments decreased. So there
mm.
was less need to do those adjustments.
That makes sense. You guys, when I was in that pre-op appointment, and then you busted out this damn laser light, and there's like the laser light going across, and I was like, "It makes sense now. Of course, your lines are perfect. You're using like it's just, there's the tape measure, there's all that, but then he busts out the laser light and everything lined up perfectly." I was like, jaw dropped. I was like, "Okay, I get it now. It makes sense." Okay, so, um, Andrea, there's your answer. We have another question from Shannon Santani. She would like to know, what's your favorite procedure to do?
Hard to say, but I would go with tummy tuck.
Favorite?
Yeah, I love tummy tuck.
What's the least favorite, or one that you want to get better at?
Uh, well, I think I want to get better at all the procedures.
Okay.
I couldn't say one. I think uh, uh, getting back to the obsessive personality,
Mm,
you know, you're always criticizing your work. You're always wanting more. You want to deliver i- better and better and better results every day.
yeah.
So I think we all are very hard on ourselves. We talk about this a lot with the other plastic surgeons, and we're always giving us advice and
Mm,
little things we change in order to improve this and that. And I can tell that they're the same as me, very Chris. I don't know how to say it, Chris,
critical.
very critical
Yeah.
of our own work.
Yeah.
Okay. And I look at Dr. Lasso's, Dr. Nico's, Dr. Rio's work, and I'm I'm surprised. They do so nice work, and you're always looking to get better
To
at
do.
every.
Yeah.
Yes.
I mean, that's got to be stressful for you guys, but it's great for us. So thanks for that. You just can't switch
Yeah.
it off. Okay, and then
You
we.
know, at first, when I started being a plastic surgeon, and especially when I started working with weight loss patients,
Mhm,
because they're not the same as like any standard plastic surgery,
mhm.
aesthetic. It's a lot more challenging, and I couldn't sleep at night.
Oh
Think
no.
of what I'm gonna do tomorrow,
Yeah.
what how I'm gonna improve this area and that area, and I was dreaming that I was doing the surgery, and it was hard, and yeah, I couldn't sleep well.
Wow.
That was the first, and as you gain experience and you do this every day, so it's starting to become very natural
Yep.
and normal, and I can't even remember when I stopped, being worried and
Worrying.
stressed, and
Right.
not because of
Yeah.
that.
So you're just a natural at it now, but yeah, I can imagine it would be
Yeah,
stressful because our skin is just so different from a regular patient who hasn't lost any amount of weight. So I can
yes,
imagine that would have been very stressful.
and also not every patient is the same.
Yeah.
So they some patients lose weight, and even if they lost the same amount of weight, the skin type is different. The areas, the excess skin is more on the upper body, lower body, on the back. So you have to adapt, and you have to get this feeling,
Yep.
and that nobody teaches you. Not even it's not in the books.
Yeah.
Have to do it so many times so you get familiar with every skin
Mhm.
type, with every body type, and then at this point, like, it just flows naturally. You don't
Yeah.
have to think about it. You just do what you know. Yeah,
Yeah. Well, you
it's
guys
so
are artists. Like you really are. Like you are surgeons, you're doctors, and you're very skilled in like book smart. But when it comes to like you're very creative. You are like a painter or a sculptor or whatever. You have to have that talent. You know what I mean? Like that kind of stuff that can't be taught. Like so, this stuff you just have you're talented. You're very educated and you're very smart, but you're also very talented, which is makes a huge difference with a plastic surgeon, you know what I mean? You either got it or you don't. You can read about it, you can learn about it, but you got to be about it, you know?
yeah.
Yeah.
It's actually funny that you mentioned this, because I am the worst at drawing, at arts. I cannot paint. My drawings were shit, you know? They're awful, awful. I can draw a stick man, and that's it, you know. But when it comes to drawing in the body and marking and preparing for surgery, I don't know. It's just easy. I
It
think after drawings in so many bodies, I think my drawing skills are improving a little bit.
There you go. But,
And
your medium isn't a paper and a pen, your medium is skin, it's body, so it's you're still an artist, just in not necessarily on paper and with paint and canvas. Your canvas is our body, so
yeah,
yeah.
and you would think that is more difficult, but for
Yeah.
me, it feels easy. But if you give me a pen and a piece of paper, you won't get much.
You're like, give me my laser light, give me my tape measure. I need a little help here. Okay, so we have Alicia Russell. She is having surgery January 30th, and she has a question. She's wondering if you can lipo above the torsoplasty. And what I think she means here is, I think you guys call it the buffalo hump, right?
Yes, the buffalo hump.
Okay, so is that
Yeah,
something that can be done?
sure.
And can she talk
But
to you?
when we see that there's some fat pad or fat deposit here,
Mhm.
just below the neck, we always do liposuction.
Okay.
It's part of it. All the back is considered in liposuction. When we do tummy tuck, we also do 360 liposuction. So that includes upper back, lower back, flanks, waist. So there it goes. Yeah.
Perfect.
Sometimes that fat pad is very like fibrous,
Mhm.
dense, but we do our best to decrease that and to make it as smooth and flat as possible. Mhm.
Awesome. So she said, can she talk to you about that during your pre-op? Absolutely. He's
Of
got you.
course.
Don't worry, girl. He's got you. And then we have Samantha Burnside. Now, if that name sounds familiar, she was your patient today.
Oh yeah.
Yeah. So she wanted to know, uh, was her surgery fun for you to do?
It was,
It
yes.
was.
Yeah.
How was
Uh,
her results?
she's very cool.
Yep.
She's very nice. Um, she had this body type that allows us and to give a very nice result.
Mm.
She already had a waist, good complexion, and good skin. So you can look for her results now. They're on the page.
Oh, you posted them already?
Yeah, we post them.
Oh, I
Uh,
have to check. I'm so curious to see how her tattoo turned out because she has like a tattoo
yeah,
here. I want to see how that
a
looks.
bat.
Yeah, the bat.
Very cool.
Is it? It turned out good? Like, because you guys, a lot of the time too, like, sometimes there's really bad tattoos and you guys just completely remove them. But then there's like really good tattoos. And I've seen, I think it was your works. I think a lady had a tattoo here and then you placed her belly button right in like one of the little hole. Oh, it was perfect. Like the best belly button placement I've ever seen that complemented her tattoo. I'm like, you guys are so good. So I
Yeah.
can't wait to see how
Some
the bat turns.
sometimes we can work with tattoos, and
Mhm.
sometimes they're just in the way.
Mhm.
It's difficult. But we can't you know plan according exactly to the tattoo. We
Yeah.
have and according to the skin and the body and anatomy.
Mhm.
So if we can do both, excellent. If
Yep.
not, then the tattoo loses.
Tattoo's gotta go. Yeah, it's, you can get it redone. We have Liz Duhack. She's nervous about the BBL, and the risks that come with the BBL. How do you avoid fat embolisms?
Okay, that's a very fair question because from all the procedures that we do, BBL is the one with the highest risk. Okay,
Mhm.
so what we do for BBL and to keep it safe is that we only inject superficial because if you go very deep, you can uh, cause an injury to a gluteal vein, and that's when the problems happen. The fat, if the gluteal vein is ruptured, okay, or injured, fat can get in there, and from there it can travel to your heart and lungs, and that's super dangerous. Okay,
Okay.
so the first thing that we have to consider is not going deep. All right. And second of all, we only inject from one area. Let me show you with my plan. Here's the
Oh,
B,
nice. I
right?
like that.
So the incision for BBL is right here. Okay.
Okay. Okay.
Sorry. There you go.
Mhm.
Okay. We do it here. So you have the sacrum, the bone, protecting you from getting in an angle that can affect and cause embolism. Okay. So injecting only from that area helps you to avoid a danger zone. Okay. I also use another two sites for injection that is here and here, but only for hips. Okay.
Okay.
So I don't go anywhere near the gluteal veins when I enter here. Okay.
Mm-hmm. Awesome. Well, I hopefully that eases her nerves about the BBL.
Yeah, and we haven't had any complications about fat embolism, okay, related
Perfect.
to BBL. So I think we do it in a very safe way, and let's hope to continue that way.
Yeah. The second part of her question was, has anyone died from a BBL? But
No,
no,
no.
you guys do it in a very, very safe manner. That's really good to know. She also has a fun question for you. She wants to know, do you listen to music in the OR? And if so, what kind of music?
Yes, always, always. Music is a very important part of the surgery. I think the mood changes a lot when there's complete and absolute silence.
Yeah.
So we don't like that. We always listen to music. Imagine we're there from 30 to 36 hours a week.
Mm,
So we listen to all kinds of music. You name it. We have listened to country music, um, rock, of course,
uh-huh.
rap, um, Mexican music, Mexican pop, uh, American pop. We have
Everything.
many, many things. But what I like the most to listen to is rock. Okay. I like the Killers, sorry, the Killers, Red Hot Chili Peppers, Green
Nice.
Day, Muse, Arctic Monkeys, and Dr. Aguirre also is a super big fan of music. So he he's always changing and putting music, and he also accepts patients' requests. So
Oh,
if
nice.
if the patient has a song that relaxes or uh, that she
Yeah.
she really loves, she can request it, and that's your anesthesia song, and he'll start anesthesia with that song, and you go to sleep like really relaxed.
Oh my God, I love that. That is so
Yeah, it's so
cool.
cool.
You guys are so awesome. We have Ellen Lozano. She said she believes that you used to do trauma emergency surgery prior to plastic surgery. Is this true? And then what made you want to choose plastic surgery instead?
Oh, okay. No, the thing is that in our training program for plastic surgery, you see trauma.
Mm-hmm.
Okay, at the hospital that I trained in was a trauma center. So you work with burn patients, with hand patients, accidents, all kinds of wounds. Okay, so it's not that I had another line of work or specialty. Is that's just part of plastic surgery.
Yeah.
It's very complete specialty. So you have many areas to work, but I specialized. Well, not specialized. I focused finally in body contouring and especially weight loss patients. But it's not that I changed or I did another different training and then just forgot about it, and not
Right.
like I quit. Hmm.
Yeah, yeah, you have to go through that in order to get to where you're going. I think it's a bit different in the US, so um
Yeah,
that
probably.
yeah, that makes sense. Okay, and then we have and she said she loves your work. She's a huge fan.
Thank you.
Now we have Temi Cruiser Brett Host. She says, honestly, you're the best. And she said her question would be, would you rather do a short scar thigh lift on a patient? She realizes, like, depending on the amount of skin, but is it more complications with like an extended thigh lift?
Mm, I think it's pretty much the same.
Okay.
Uh, I would consider more what the patient needs. If the problem is only in the upper third of the thigh, then a short scar thigh lift will solve it. Okay. But if it's more than that, and it goes all the way to the knee, the excess skin, then an extended thigh lift is the best option. But I don't prefer one over the other. Both are good options when it's what the patient needs.
Gotcha. Okay, and then we have Jennifer. She wants to know, how does it feel to know that you helped change so many lives?
Well, it's not like when we are in the OR, we're thinking that we're changing a life.
Right.
You're you're focused and you're doing your thing. Uh, but when I realize that is when I see a patient time after the surgery, like when they post on the page all their journey and the picture before weight loss surgery, then after weight loss surgery, and then after plastics. That's when it really hits you. That's
Yeah.
when it, wow, I did that, and it feels so cool.
Yeah.
It's very fulfilling. Yeah,
Yeah. That's
I
awesome.
am very pleased and grateful to be able to do this, and it's a very cool job.
Well, we appreciate you. She said that she can't express how impressed she is, and your kindness and attention to detail and quality of your work is just top notch. Then you have a past patient, Nadia Zappos. She wants to know, did you ever finish watching Terrifier 2? And she's not going to let up on that.
Oh, sorry, Nada. It's still in my to-do list. I really have a very limited amount of time to catch up on
Yeah, you
series
guys,
and
he's
TV and movies. So
plays tennis and gym
uh,
and,
yeah, answering our emails.
and
Yeah,
podcasts. No, just throw
and
that into the works.
podcast every
Yeah.
Thursday. Just
I know, right? So next Thursday. Okay, and
yeah,
then
but I promise I'll see that.
all
I'll
right.
see
She's
and
gonna
watch it.
hold you to it. April Bracken wants to know, is there any sense of doing Morpheus or Sculptra if they're doing a procedure within a year or so?
Okay. Well, they're different, very different kinds of procedures. If you're doing Morpheus, you can do it even like every month or every 2 months. Okay, if you want to if you're starting, you can do it every month or 3, 4 sessions, and then just maintaining. Okay,
Mhm.
but for Sculptra, you can do that only once a year. Would be my advice, or you can do it every 2 years, but not several times in 1 year.
Okay. Is there any point to do it before surgery, or is this something they should do after surgery?
What surgery?
Like, let's just say they're coming to you for skin removal or a mummy makeover. Should they do any of this beforehand, or would it be pointless?
Okay, for uh, the question, I think she means the face. So if we're working on her
Oh, the
body,
face.
th-
Okay, my bad. I'm thinking she's talking about body.
yeah. But if
Ah,
she's talking about body, then I would recommend not to anything yet until after surgery.
gotcha.
Yeah.
And then one last question, which you kind of touched on earlier, but Lauren McConnell wants to hear about the Faha routine post-op, like the brands, the compression levels, the stages, all that kind of thing.
Okay. Good question. Here at the office, when we do the markings, you can try a faja. So if it fits well, that's yours. Okay, and that's what you take. I only use Fajate brand, but I know also Morena brand is very good. So I don't have preference. It's just that the provider has it really quick for me. So that's the only reason I use it. I like it very much, and patients have liked it. They feel comfortable in it. So that's the main reason we use it. And for stage two, you will need that probably after 4 to 5 weeks from surgery. Okay, once the swelling starts subsiding, you will feel that the fat is not tight anymore. It's very loose, almost like nothing. So that's the right time to change for a smaller one. And it's not another kind of faja; it's just the same uh, type, just smaller, one size smaller.
Hmm. And how long in total do you recommend wearing the Faha for?
Well, at least 2 months,
Hmm.
but patients feel really comfortable when they use their faja, and sometimes get less swelling even 3 months after. So they can use it 3, 4 months if they like,
Awesome.
if they want.
Very cool. And then we had one question from someone on Instagram, and I'm sorry, but I don't have a name here. You did answer this already, but she was wanting to know about the pubic. Mons area, but that you said earlier that that gets lifted, correct?
Yes, that gets
Mhm.
lifted. Also, if we notice that the fat deposit there is thick, then we remove that fat directly. We cut it out.
Mhm.
Not liposuction because it's very close to the incision. I don't like the bruising and damaged blood supply. So I
Ah.
just make it thinner by removing, by cutting it. And then it's lifted. I think one of the reasons that we deal really well with the pubic area is because we draw the line, the incision line, very low.
Mhm.
That allows us to lift the pubic area and fix that. Patients with very severe excess skin there might need another procedure later, like in a second stage, a pubic lift,
Mhm.
but most of them won't.
Awesome.
Mm.
And that was all the questions we have. Do you have anything you want to add? This was very informative.
Really? Well,
Yeah.
just hoping that this helps a lot and gives useful information for understanding the process, the journey, what happens pre-op, during surgery, and after. Also, I wanted to ask all our patients to prepare really well for surgery. Have blood work done at least 3 months before, so you know where you are. Okay, and 3 months before surgery, start taking blood builders. Okay, iron, folic acid, vitamin C, and you can also take vitamins, but remember to stop them 3 weeks before. Okay.
Beautiful, beautiful. Well, thank you so much, Dr. Ochoa. We will let you go and get off to your tennis lesson or the gym or whatever it is that you're running to next. We appreciate your time and we'll see you on Facebook with all your amazing results.
Thank you so much. Thank you for inviting me.
Yeah.
I hope this was informative
Yeah,
and helpful.
it
Okay.
it
And
absolutely
uh,
was.
and you know we're always there for you. If you have any other concerns, any questions, feel free to ask them. We have coordinators. We have the Facebook page. We try to answer the doctors. Try to answer as much as we can, but with a tight schedule, sometimes it's a little difficult.
Yep. And
But
so my mission, and actually somebody mentioned this in one of the questions too, is that they want to get all of you surgeons together. And I think because you guys like to come to Vegas and I'm in Vegas, the podcast studio is in Vegas. So I'm putting it out there to the plastic surgeons, Vegas trip, all of you guys in this studio because we have room for like 5, 6 people. So I mean, if you guys want to see it, let me know. We'll make it happen.
well, that sounds very cool.
Vegas
We
trip,
love
let's do
that.
it. Okay. Well, thank you so much, Dr. Ochoa. You have a good evening and we appreciate your time.
Thank you so much.
Thank
Bye.
you. Bye, guys.